Rachel. I'm Billy. I'm a PA student. I'll be doing your cardiology exam today.
Hello.
How are you doing today?
I'm fantastic. How are you?
Good. Kind of late, but you do what you gotta do. Just gonna start by washing my hands. Did a little too much. But, and we already did your vitals, so we're good there. So I'm gonna start by doing a lung and chest exam. So I'm going to start by listening to your lungs. I'm going to start with your back. Do you mind if I undo your gown?
Yes, please.
Yes, please. So nice of you. Alrighty, so each time I move my stethoscope, just take a deep breath in, okay? Good. Your lungs sound nice and clear. Next, I'm going to have you just drape your chest. I'm going to listen in the front. You can put your shoulders back. Same thing each time I place my stethoscope. I'm just going to have you take a deep breath, okay? Alright, next I'm going to just have you kind of roll up your sports bra and just hold it like that. Perfect. Two more. Awesome. Everything sounds great. Alrighty. If you want, you can go ahead and slip your gown back on. Next, I'm going to have you lay back at our nice 30-degree angle. If you want, you can scoot up. Do you want the blanket on? And it's kind of hot, but up to you.
Yes, please.
Okay, perfect.
I'm gonna
Go ahead and scoot up if you'd like. Whatever makes you feel most comfortable.
Yeah.
Alrighty, I'm going to start by inspecting your neck and just looking for any jugular venous pressure. Next, we're going to do this thing where I calculate and measure your jugular venous pressure. So I'm going to have you do is I'm just going to have you turn your head that way, and I'm going to feel for your sternal angle. It's right about there. And go ahead, forgot my other ruler. Go ahead and relax. Alrighty. Just looking for pulsations. Alrighty. And it's about 2 centimeters, so if it was greater than 3 centimeters, that would be considered elevated, but since you're at 2, you're all good there. Alright, next I'm going to palpate your carotid pulses, so just turn your head for me. Good. Go ahead and turn the other way. Great job. Okay, and then I'm just going to listen. Do the same thing. And I'm listening for any bruits. So take a deep breath in and hold your breath for me. Good. Other way. Deep breath again. And hold it. Good. Sounds good. Alrighty. Next we're going to move on to the cardiac exam. So I'm going to have you undrape yourself, please. Perfect. Okay, so first I'm going to inspect your pericardium, looking for any aortic impulses, lifts or heaves. And then I'm going to check for thrills, which is essentially just abnormal vibrations. So I'm just going to feel the lateral border of your heart, the base of your heart, and the apex. And I don't feel anything. Next I'm going to go ahead and measure your apical diameter, so how far it is. So I'm just going to go under your sports bra here a little bit, right in your 5th intercostal space. Starts about there. So I'd say about that. Just going to go ahead and measure it. with my nice Smokey the Bear ruler. It's about 2 centimeters, so that's in normal range. And then I'm going to go and feel for that point of maximal impulse again, right there, and I'm just going to measure it to your mid-sternal line. And you're at about 10 centimeters, which is also normal. Alrighty, moving on to listening to your heart. You can go ahead and relax, but I'm going to listen with both the diameter and the bell, so it's going to be a lot of flip-flopping. So first I'm going to start with the second left intercostal space, second right intercostal space, right sternal border, listening for your aortic valve. Good. Your second left intercostal space, left sternal border, listening for your pulmonic valve. Good. Your third left intercostal space, left sternal border, listening for your second pulmonic valve or your Erb's point. Good. Beautiful. Next, listening to your fourth left intercostal space, left sternal border, listening for your tricuspid valve. Good. And then I'm going to have you hold yourself up again. Perfect. This is your fifth left intercostal space, left sternal border, listening to your tricuspid valve. Perfect. Then finally, your last one, your fifth intercostal space, mid-clavicular line, listening for your mitral valve, or you're at your apex. Good. You have a nice, strong, not abnormal, a very normal heart rate. And then I'm also just going to feel for, I'm going to listen to make sure that your carotid pulse is synchronized with your S1 and S4. It should precede. Your carotid pulse should follow S1 and precede S2, which is exactly what it sounds like. Awesome. Okay. Next, I'm going to have you roll over on your left side. Great job, cameraman. Okay, so I'm going to have you kind of, lift your bra up like that, and I'm just feeling for your point of maximal impulse. It's right there. Sounds great. Next, I'm just going to do a special test, and I'm listening for any mitral murmurs. So I'm just going to give it a listen. Good, sounds great. Laying on your left side just accentuates if you were to have any mitral murmurs. Alrighty, you can go ahead and sit up for me at the end of the table if you'd like. Perfect. Alrighty, now we're going to do 2 more special tests. The first one, I'm going to have you lean forward, and I'm just going to listen down the same places on your left side that I did previously. And I second guess myself. And I'll have you lean forward, exhale completely, and then hold your breath. So let me know if you breathe, that's okay. But sounds great. Good. And that's to accentuate any aortic murmurs, and I didn't hear any, so that's good. Finally, the last one we're going to do is, do you know what bearing down is?
Yes.
Okay, perfect. It's also called the Valsalva maneuver. This will accentuate any hypertrophied cardiomyopathies. So I'm just going to have you, bear down, and I'm going to listen in those same exact spots. Last one. Good. Didn't hear anything either. So everything's looking great. Okay, if you want, you can go ahead and slide your gown back on.
Oh boy.
Yeah, do you want me to tie it for you?
Sure.
Okay.
Thank you very much.
And then, no problem. Next, we're gonna just do a quick peripheral vascular exam, and then I'll get you out of here. So, I'm gonna do you mind if I take this away? I just need
Go
to see your
ahead.
legs. Perfect. Alrighty, so first I'm gonna start by inspecting the skin for any size, symmetry, venous things, rashes, ulcers, scars, any distribution of hair, irregular distribution of hair, and everything looks good. Next I'm going to inspect the temperature and texture of your skin, so I'm going to have you hold your arms out. So testing for temperature and texture, good. Same thing with your legs. Do you mind kind of rolling you? Perfect. So temperature, ooh, nice and warm. And texture, good. Next I'm going to check for capillary refill. So this is just to make sure you have blood flow, proper blood flow. And you have nice painted toes. So I'm going to do the bottom of your feet. Looks good. Great. We're going to check your pulses bilaterally. So we'll start with your radial pulses. Good. Next we'll do your popliteal, which is behind your knees. You can go ahead and relax. Good. You can actually feel that one pretty good. Next we'll do your dorsalis pedis. So go ahead and flex your feet up for me. Perfect. Good. Finally your posterior tibial. Those feel good too. Last but not least, I'm going to check for any pitting edema. So check on tops of your feet here. The back of your ankles, good. And then on your shins. And good, no pitting edema. Alrighty, thank you. Everything checks out great. So
Thank you.
I'll let you have a great rest of your day. Thank you very much.